There we go. All right, it is recording.
That's good.
Good morning, everyone. My name is Scott Wilson. I am the trainer for FEI Systems with regards to the WITS software solution that you all have been using. And today we're going to be going over what we call WITS Grant Management Training, or what you guys know as SOAR training. With us today, I've got Jaquetta Foreman and Ellen Stroud from North Carolina to help assist with answering any questions that you all might have. And Ellen, I believe you had some words that you wanted to.
I do. Hello, everyone. What a great group. Thanks for being with us for GIPRA training today. Just wanted to kind of give an overview of the importance of this and how it all plays in together. The State Opioid Response is a federal grant that is administered by the North Carolina Department of Health and Human Services. This year it'll be about $36.5 million. And most of that money we'll actually spend even a little bit more than that this year, so that we'll have about $28 million that we will to get a of money that will go to the 28 million will go to treatment. So as opioid treatment programs, or whether, and then in addition to that 28 million recovery services that we do, and that folks in the field do, that money goes to pay for that. So $28 million for treatment. And so to be able to do that, one of the requirements of the federal money is the GIPRA, is this assessment. And we've contracted with FEI to use their WITS management system for this. Many of you have done the GIPRA in the past. Some of you may be new staff. So we're thrilled to have you with us. This training will be is being recorded and will be available on the DHHS website in the future, so that your colleagues can enjoy the training as well. And you all know Jaquetta. She manages our side, the state side of the system, and is the one who sends out our reminder emails and error reports and keeps everything on track and the trains running. So I appreciate her work and being here today. So just wanted to kind of give an overview of how all this fits in. A big push this year, even more so than last, is that we get all the intakes so that everyone who is on the SOAR grant, some people used to call it state funding, but this is those folks that qualify for SOAR, and that they get an intake, and then at least 80% of them get a follow-up interview in the 5 to 8 months after having their intake. So hopefully that this training, Scott is terrific. I've already done one training with him this year, and it's terrific in understanding what we do. And he's learned about our system in North Carolina, so that's helpful. So he will go through the tool, and if you have questions about kind of more North Carolina specific or anything about the SOAR grant, happy to take those offline, and I'll be checking the chat box for those, or you can email us as well, and I'll put our emails in the chat for you guys. So thank you so much, and Scott, take it away.
Thank you for that. I appreciate it. All right, so let's go ahead and get started. I already introduced myself real quick. So for today's training, there are a lot of us in this call right now. It's up to 93 since we started the session. So what I'm going to ask is, inside of Zoom, you're going to have some options down at the bottom of your Zoom window. One of those is going to be Q&A. If you have any questions, instead of like raising your hands or using the chat, what I'm going to ask is that you guys click on Q&A. It'll open up the question and answer box. and then you'll have a section for typing in any questions that you may have so that you can then submit them to us. As I see those questions, I will take a moment to answer them. Just be aware that if I'm in the middle of talking about a topic, that I might finish talking about that topic before I take your question. Also, some of the questions may be answered by Ellen or Jaquetta through the question and answer box as well. All right. And with that, let us get started. So for today's agenda, what we're going to do is we're going to review the grant management workflow for the state of North Carolina. Well, and in general, as far as like creating the client record and enrolling them in a or creating that intake for that client once their client record is created, then enrolling them in a SOAR program. And then we'll talk about completing the GIPRA, how to create that initial intake GIPRA, answer all the questions, and then complete it so that that information is then submitted to SPARS. And then once that's done, we'll talk about consent and referrals. So if you ever need to refer a client from one agency to another for treatment, we'll talk about what that process looks like in WITS as to how you can track that. And then we'll talk about the 6-month follow-up. And then after that, we'll discuss how to complete the discharge GIPRA and then discharge the client from WITS. And then finally, we'll talk about some reporting options that are available for you. Rayan, I see that you have your hand raised. Again, if you would use the question and answer box to ask your question, and then we'll be happy to answer those for you. And then Maria, I see that you just raised your hand also. If you would just use the question and answer box in Zoom, it should be located, I believe, at the bottom of your Zoom screen. Just click that Q&A box and then type your question in, and we'll be happy to answer it for you. Okay. All right. So let's talk about the grant management workflow. Before we do, it's been asked from me in the past to just go over a couple of the terms for those of you who might not be as familiar with the GIPRA and WITS and everything else. So just a couple of the terms that you're going to see or that you're going to hear me say today. The first one is going to be GIPRA, and that stands for the Government Performance and Results Act. This is a document that's used to record various data related to the client's substance use and proposed treatment. That's something that a lot of you will be completing on your clients on a regular basis. Once that GIPRA is completed, it gets submitted to SPARS. And SPARS stands for SAMHSA's Performance Accountability and Reporting System. And this is just a web-based data entry system that is used to capture and report that GIPRA data to SAMHSA. And then so that brings us to SAMHSA. So SAMHSA stands for the Substance Abuse and Mental Health Services Administration. This is basically a federal program that's goal is to improve mental health and substance abuse treatment services. Oh, Ellen, you're saying that it's not letting you post to everyone? Okay, hold on just a second. I might need to promote you again. Make a co-host.
Thanks.
Yep, absolutely. I'll do the same for Jaquetta. All right, so you guys should be able to change now in the chat to post to everyone. If it still won't let you, let me know.
No, it's still not.
Oh, I had to click yes. Sorry about that. I had to say yes, make you a. I had to click the option to make you a co-host and then say yes, make you a co-host for some reason. All right, so let's take a look at the workflow for the SOAR or for your clients that will be enrolled in SOAR. So the workflow is always going to start with the client profile. So you're going to go into WITS and you're going to search for a client if they come in requesting services. You'll search for them in WITS first to make sure that they don't already exist in your agency. If they don't, then you'll create that client record for them. Once that client record is created, the next step is to create an intake for that client. So you'll click create a client, an intake record for that client. And once that's done, you'll be able to enroll them into the SOAR program. Once they're enrolled in the SOAR program, you'll then be able to generate that initial GIPRA for them. It's called the GIPRA intake, and you'll have quite a few questions that you'll need to complete on that GIPRA. Once that's all completed, then you'll click the complete button down at the bottom of the GIPRA. That'll lock it, and then that'll cause that data to be sent from WITS to SPARS, typically overnight, but at regular intervals, we will transmit that data from WITS to SPARS. And then within that workflow, sometimes you have a consent and referral. So maybe you do not offer the services that the client needs, and you need to refer them to another agency, in which case a consent record will need to be created for that client in WITS. And then from there, from that consent record, a referral can be generated for that new agency where they'll be receiving treatment. As Ellen mentioned earlier, around the 5-month mark after the initial GIPRA intake was completed, will be a window that opens up for that 6-month follow-up. So between a 5 and 8-month window, you'll be able to create or complete the 6-month follow-up GIPRA for your client. Again, once that GIPRA is completed, it will get transmitted to SPARS automatically for you from WITS. And then when that client no longer needs services and they're ready to be discharged, there is one final GIPRA that is completed. That's the GIPRA discharge record. And then once that's completed, it also is transmitted to SPARS. And then after that's done, you can then close the program for the client and then disenroll them, which will disenroll them and then close out their intake. All right, so let's take a look at what all of this looks like. When you log into WITS, you'll land on what we call the home page. So from your left navigation bar, you'll see up in the top left-hand corner, there'll be the very first option from the left navigation menu is home page, and that's where you're going to land. The home page has some information for you that you can find helpful, such as the first tile will have like today's date. It'll say hello and your name. But then to the right of it, sometimes you'll notice that you'll have some messages listed there. So any kind of notifications that come in to WITS regarding you, it'll alert you to those notifications. If you're responsible for handling referrals coming in for your agency, then you'll see that you'll get notified anytime a client has been referred into your agency. That'll also display up in this first tile. Next, you've got the announcements tile. The announcements tile can be used by your agency administrators or even the state administrators to put up announcements to just inform you of any events or any tasks that are coming up that maybe need to be completed. So for example, and I've got like a Christmas announcement up that says that offices will be closed on certain days, but your administrators can use the announcement sections to post all kinds of notes. If you ever want to see the details on those notes, you'll see to the right of that announcement will be a right arrow. Clicking on that will open up that announcement and give you any additional details that may have been provided for the announcement. And then also you've got the alert list. So the alerts, if your agency is using alerts, then when certain events are triggered, then alerts will display here to let you know of certain tasks that maybe need to be completed. For example, alerts can be set up so that users get alerted whenever their clients are coming up due for that 6-month follow-up, for example. All right. So when you have your client, they come in and they say, or they call in, however you're contacted with regards to that client, they say that they need services. You'll go to this client search screen and you'll want to search for that client before you add that client record into WITS. So you'll want to make sure that that client doesn't already exist in WITS. when you are doing a search, and this goes for any search screen for that matter. So, your main search screen that you're going to see a lot, that you're going to be working with a lot, is going to be the client search screen. But for any search screen, you'll notice, or what you may not be aware of, is that you have access to what we call operators and wildcards that you can use for performing searches. So a wildcard is an asterisk that you can place either before, after, or in between text, or I'm sorry, on either side of text. And how you use that will affect the searches that you perform. So for example, if I place the asterisk before my text, then whenever I click search, it'll look for any records that end with that inner text. So in my example, I've got the first name box, I've got asterisk and text. Then in that case, it'll look for any clients whose first name ends in text. If I place the asterisk after whatever my text is, then whenever I do the search, it'll look for any records that begin with that inner text. So again, for like last name, if I say I type in WIL and then asterisk, then it'll look for any clients whose last name begins with WIL. So it could be like Williams or Wilson, Williamson, that sort of thing. And then in placing an asterisk before and after the text, we'll look for any records that contain whatever text is between those asterisks. So in this case, like if you're doing a search for a client number, like a part of that client number has 546 in it, then you can do asterisk 546 asterisk, and it'll look for any client records that contain 546 in the unique client number. And then you also have operators. The operators are like your less than, equal to, greater than, and greater than and equal to signs. These can be used before numbers or dates. And then what it'll do is, depending on what you type in, so for example, if I say less than or equal to, and then put in a person's date of birth, then it'll look for any clients whose date of birth is, say, October 1st, 2000 and older. And then finally, you've got this pipe symbol that you can use. Using the pipe symbol between text or numbers will cause WITS to look for either entry. So in my example, in the provider client ID, I typed in 5498, the pipe symbol, and then 9885. In that case, whenever I click search, WITS will look for any records that have a provider client ID of 5498 and 9885, and it'll display all of those records for me. So just some search options that we have available that we wanted to make you all aware of to help you guys locate your clients more quickly and efficiently. All right. So as I said, whenever if a client comes into your agency, they call in, get referred to you somehow, they say that they need treatment. The first thing that you're going to want to do is go to client list. So if you click client list from the left navigation menu, it'll automatically take you to the client list screen, and you'll have the search up at the top. Again, you always want to search for your client before you create them, because maybe they've been in for service at your agency in the past. So do a search, make sure that the client doesn't already exist in your system. And if they do, then to the right of their name, you'll see that there's a vertical ellipsis. Hovering over it, you'll have the options of accessing the client's profile, accessing their activity list, and their link consents. Clicking on the profile will access the client's profile record. Clicking on activity lists will access the activity list screen, which we'll take a look at a little bit later. Otherwise, if the client doesn't exist, then you'll just click the plus add client button. All right. Clicking on that will open up the client's profile, and you'll notice that in this screen, and you'll see this on every record really that you go into in WITS, is that you'll have some fields that have an orange bar to the left of that field. Any fields that you see that have that orange bar to the left of the field, these are required fields, and they must be completed before you can save the record. Okay, so in this particular case, I'm on my client profile screen, and it's telling me that I have to capture the client's first name, last name, their sex, social security number, date of birth, and like provider client ID in this example before I can save the client profile. The required fields that you guys see on your screens for the state of North Carolina will differ based off of whatever requirements the state has set for you guys. All right, so we'll create the client profile and then click the save button. In some cases, whenever you click the save button, WITS may throw an error at you and tell you that an address has to be added to the client record before you can save. If that's the case, then you can like scroll below the client profile and then add like the client's address, or you can click the next button to also navigate to the contact information screen where you capture the address. But some other screens that are available to you underneath the client profile that you can where you can capture information are listed here. So like once you create that client profile, you'll then see that you have access to these other screens underneath the client profile, such as like alternate name, additional information, contact information, and so forth. Some of the more common ones that you guys will be using will be such as the contact information screen. This screen is used to capture address for the client, as well as their email address, phone number, preferred contact method. Collateral contacts can be used to capture any contacts that are supporting the client's treatment. The additional information screen captures demographic information for the client. And then the other numbers screen is also sometimes used, and it can be used to capture information such as court case numbers or any state federal IDs. All right. Quick question. Michelle's asking, what if our participants don't have any contact information? I believe, I could be mistaken, but I think I can confirm this whenever we get to the demonstration, but I think for the state of North Carolina, Michelle, that it does not actually require you to capture contact information. I know it's typically a best practice, and I'm not quite sure if Ellen or Jaquetta have anything else that they want to add with regards to that. I see Ellen typing right now, but yeah. So once that client profile is created, the next step is to capture the intake for your client. To do that, you can click the activity list menu option, or underneath activity list, you'll see episode list. You can also click on it. Clicking on either one will take you to the episode list screen, and then you'll just click this button that says start new episode, and it'll open up the intake case information screen. Again, at the very minimum, the required fields need to be completed. There are additional fields, just like there were on the client profile screen. These are all optional fields. Capture them if you have the information. Otherwise, you can leave them blank and then just click Save and Finish. Once the intake is created, you'll then be taken to the activity list screen. So you'll remember if you hover over the vertical ellipsis for an existing client, one of the options that you could select is the activity list. Clicking activity list, or after you create that intake, will take you to the activity list screen. And the activity list screen is going to show you all of the actions that have been taken on your client record so far. So on the activity list, I can see that my client information profile has been created, as well as the intake. And then you'll notice that you have this status column, and underneath the status column, it'll either say completed or in progress. If it says in progress, beside it, it'll say details in parentheses. Clicking on details will then inform you of what information still needs to be recorded for your client for that record to be considered complete. Okay. And it looks like Vanessa is asking a question. It looks like it's directed at Ellen, so we'll continue. But if you need me to answer it, Ellen, just let me know. All right. So the next step then is, after the intake is completed, is to create that is to enroll that client in your SOAR program. So underneath activity list, if you need to, click on it to expand the submenu, and then click on program enroll. That'll take you to the program enrollment screen, and you'll see a button that says plus add enrollment. Clicking on it will open up the program enrollment profile. And here you'll need to just complete 3 required fields. There are additional fields, but you're not going to complete them right now because like termination and end date are only entered in when the client's no longer going to be enrolled in that program. So on the program enrollment profile, you'll choose which program you're enrolling the client in, who's the staff member that's enrolling them in the program. If it's not you, you can change that to whoever that staff member is, and then set the start date. The start date for the program enrollment profile as well as the intake can be backdated if needed. So say the client actually came in for services on Friday, maybe for some reason you weren't able to capture the intake and the program enrollment on that date, you can go into WITS and backdate it. So like if I was putting it in today, I could actually put in Friday's date for the intake date and the program enrollment if I needed to. Once the program enrollment profile screen is completed, just click Save and Finish. And at that point, you'll notice that in your submenu underneath Activity List, the GIPRA assessment option will now be available. The GIPRA assessment button is not going to display until you've enrolled that client in a SOAR program. All right, so once that client's enrolled in a SOAR program, you'll see that GIPRA assessment button. At that point, when you click on it, it'll take you to the GIPRA screen. This screen is where you're going to see any of your previously recorded GIPRAs for your clients. So like after you capture that initial intake and you go back to do your 6-month follow-up, you'll see the initial intake GIPRA on the screen, as well as like after the 6-month is done and any additional GIPRAs like, the discharge, that sort of thing. To create a new GIPRA, you'll click Create New GIPRA Assessment up in the top right-hand corner of the screen, and then this will open up the Add GIPRA Assessment window for you. On that screen, you'll need to choose the type of GIPRA that you're completing. So if it's the first GIPRA for the client, it's the intake. If it's the 6-month follow-up, you'll see 6-month follow-up in the drop-down, and then the other option is discharge. Once your interview type is selected, you'll then need to choose whether or not it says client description by grant type. You'll need to choose whether or not the grant is for treatment services or recovery services. So you'll choose treatment if they're starting treatment, or if they're just using the SOAR funding just for recovery services, then you would choose recovery. Put in your assessment date, choose the program, and then click Save to finish creating that GIPRA. All right. So let me show you what those screens look like. Here we go. All right, cool. So, so I've logged into WITS. Whenever I log into WITS, I'm actually in the North Carolina training instance. But whenever I log into WITS, as I said, it's going to automatically take you to the home page. So from the left navigation menu, you'll see home pages in white. This is what letting me know that this is the active tab for me currently. And then I've got my different tiles that can display information for me. So my first one's giving me today's date, saying hello Scott, and then it also lets me know, like in this case, it's telling me that there's 3. Again, this is just a training instance, so the messages that we see may not be what you guys see in the live instance, but it's like letting me know of any messages that are system messages that pertain to me. Announcements, if any announcements had been set up for this training, for my agency, then those announcements would be displayed here. So like if my WITS administrators at the state level or even at my agency level had put in some announcements to like let me know of any upcoming office closures or any other kind of events, then those announcements would be displayed here. If I had any clients and alerts were set up, then alerts could display here to let me know if maybe those clients were coming up on that 6-month window, for example, for the follow-up, for the 6-month GIPRA follow-up. All right. So if I have a client, they come in or they contact us in some way, shape, or form and say, hey, I need services for an opioid use problem. then the first thing we're going to do is we're going to click client list from the left navigation menu, and it will automatically display the client list screen for us. Here we can do a search for our client, or we can click this add client button if we don't find the client. But we always want to perform a search for our client first to make sure that they don't exist in the system before we create them as a new client. You'll also notice on this client search screen, you've got this advanced search button. I recommend using that because when you click it, it does give you the ability to search for more options than just the client's first name, last name, and the unique client number. You can also now search by their social, their date of birth, that sort of thing. This is helpful, especially for those clients that might have common last names, like Smith or Johnson, that sort of thing. So you'll do your search for your client. In this case, I'm just going to do a quick search for Mr. Diggle. And we'll look to see if we have any results that display. If we do, then they'll be listed here. If not, then you'll actually see a little message up at the top that says that no results match your search criteria. All right, so then that lets me know that Mr. Diggle is not a client currently in our system, in which case I can click the Add Client button. Clicking on that will display the client profile screen. There's always this context information that you're going to see on your various screens whenever you're creating profiles or any other kind of records. I like to just click that hide button to give me some more real estate on my screen. And then I just put in my first name, last name, and the other fields for this client. So we'll say Mr. John Diggle, male, date of birth, we'll just say 10/1/2000. And then his social. All right. Once I've got this information filled out, like I said, I can click save. If I scroll down the client profile, you'll see that there's also options to capture like their alternate name and address. Something to keep in mind whenever you're adding a client profile is that, so if a person comes in and maybe they say that their name is Tim Smith, it's quite possible that his actual first name or that his government name is Timothy Smith. So if that's the case, if you ask them, is it just Tim or is it actually Timothy? Like what shows on your social security number or card, for example, or your driver's license? If it's actually Timothy, then that's what should be captured here in the first name field. And then you can always add an alternate name and say that that the client prefers to go by Timothy, or in this case, like we got John Diggle, maybe he prefers to go by Johnny. Then I could say add as an alternate name, Johnny, to note that. Otherwise, once this client profile's information is completed, I'll click save. Doing so, if it required me to capture the address, it would have thrown an error at this point to let me know that I needed to capture the client's address before it would let me save the record. Otherwise, I can add an address from this screen by clicking the add button underneath addresses on the client profile screen. I can also go to the contact information screen for my client, and it'll also allow me to capture their address here as well. And then as well, capture a phone number, email address, that sort of thing. Okay. While this isn't required, I would imagine that it's still pretty helpful if you can capture this information, because you're going to need to do that 6-month follow-up for your client, and having their address and their or like especially like their phone number in the system will help you contact that client for that 6-month follow-up so that you're compliant on that. You've also got collateral contacts. Again, not a requirement, but again, can be very helpful for finding that client whenever the 6-month follow-up comes due. So if they have any, if you can capture any family members or friends, close friends for this client that you can record or capture so that you can get in contact with the customer or with the client for that 6-month follow-up, you can. And then there's also additional information. So like the additional information screen, this just records like demographics for your client. On the additional information screen, notice it has some orange bars on the left-hand side of the fields, but instead of it being a solid orange bar, it's a like candy stripe orange bar, or we call it also a broken orange bar. This lets you know that these fields don't need to be completed to save the record, but these are completion requirements for other things. So in this case, like if the state's doing TEDS reporting, these fields need to be completed for TEDS reporting, for example. Okay, so just be aware that that information, while it's not required to save the additional information screen, it is required for completion requirements. Real quick, Neil's asking, you mentioned that if the client exists, that on the right side there are 3 dots that give you options. Will those options bring the client profile up? Absolutely. Yep. So if so I'm in John Diggle's record right now. If I exit out of his record by clicking that X and the client ribbon up in the top right-hand corner of his screen and go back to the search screen, I'll see Mr. Diggle's record. And if I hover over the vertical ellipsis, one of the options is profile. Clicking it will take me back into the client profile screen. So it takes me right back into the client profile. And then I can see that I'm back in Mr. Diggle's record because I've got this client ribbon up at the top of the screen. Good question. Once the client's profile has been created, and if I can capture more information on them, I can. I'll do that. After that, the next step is to capture the intake for my client. I can do that by clicking on activity list or episode list. If I click activity list, it's just going to take you to the episode list. So me personally, I like to just click on episode list. And then on the episode list screen, just click the button that says start new episode. Again, you're going to see that you have some required fields that need to be completed. Some of it's already going to be completed for you. So WITS is going to assume that I'm the person that, since I'm the one that clicked create the new intake, that I'm the person that's performing the intake on the client. If that's not the case, then you guys can choose from the dropdown who that person actually is. The intake date, again, it can be backdated if needed. Initial contact, we'll just say in this case that they were a walk-in residence. So this is the county that they reside in. We're going to say Buncombe. Feeling a little homesick today. So we'll say Buncombe, and then what the reason for the visit is. So you'll want to put your comments in there as to why the client is visiting and wanting treatment, or like why they, like maybe it's they want treatment, or maybe they just have questions. Reason for today's visit, and then click save and finish. These other fields aren't required, like interagency service. I can capture that information if applicable, but otherwise just click save and finish. Once you do, like I said, it'll take you to the client activity list screen. My intake transaction screen says it's completed, but my client profile is saying that it's still in progress. If I click on details, it'll open up a window that tells me the information that's missing. Unfortunately, this window cannot be dragged. So whenever it opens up, in my case, it always opens up in the right-hand corner. If you need to, you can always click the maximize button at the top of that window. But I mean, it tells me everything that's missing. So in the little window that does display. So it tells me basically like ethnicity, veteran, and race. These are all demographics that are located on the additional information screen. And then it wants me to also capture an address. So while these aren't required to save the client record, these are required for completing the client record. So until those fields are captured, this will always say in progress. All right. Once the intake's completed, the next step would be to enroll your client in the program. So underneath activity list, we'll scroll down until we see program enrollment and click on that. Underneath program enrollment, you'll see add enrollment. So we'll click add enrollment, and then it'll pull up the program enrollment profile. It'll have the start date here. Again, I can change that and backdate it if I need to, and then I'll just choose my program. We'll say SOAR 4 in this case. What? No, all right, I must have set up SOAR 4 wrong. All right, so SOAR program, and then click save and finish. All right, so we've enrolled our client in a program. Now that they've been enrolled, you'll see that the GPRA assessment option is now displaying. So we click GPRA assessment, and here it'll show us any previous GPRAs that's been captured, which in this case there won't be any because he's a new client. But once those additional, those GPRAs, as this client starts receiving services and treatment, they will have the intake and then the 6-month and so on that'll display here. Otherwise, on the GPRA assessment screen, we're just going to click the button that says Create New GPRA Assessment. It'll open up this GPRA assessment window. We'll choose the interview type. When you select intake, like I said, it's going to ask you to choose the grant type. So is this client going into treatment, or are they just going into recovery services? So if they're going into treatment, then we'll select treatment, put in the date for the interview. We'll just say today's date, and then we'll choose the program from the drop down and then click save. When you do that, the GPRA will get created. And then that will take you to the GPRA assessment what we call the GPRA assessment workspace. And we'll see all this information here. Any questions on this so far? I know that a couple have come in. Just want to make sure that that there are no other questions that need to be answered before we move on. Okay. So let's take a look at the assessment. So the assessment's pretty long. It's got quite a few questions in it. To help you with the assessment, I just want to give you some information on how the assessment workspace is laid out. So on the left-hand side of the GPRA assessment workspace are going to be the different sections of the assessment. So you'll see like it'll say section A, B, C, D, and so on, and each one of them will then be named. So like A is for record management and demographics, B is for substance use and plan services, and so on. The middle section is where all of your questions are going to be answered. So, it'll have all of your sections and then the questions within those sections. You'll notice up at the top of each section, you'll see this button that says next question. If you click on that, it'll take you to the next question in that section that needs to be answered. So for example, if I'm looking at my completion requirements, say I've been working on that assessment and all of these sections have been dropping off, but then substance use and plan services is still displaying. I can go to substance use and plan services by clicking on it, either from the completion requirements or from the left-hand side where it's got substance use and plan services listed. And it'll take me to the top of that section. And then I can click the next question button, and which will automatically scroll to where that question is so that you guys can then answer it. So very helpful button. But yeah, on the right-hand side, you'll have completion requirements, and the completion requirements are going to be listed here. It's not going to tell you exactly like which questions still need to be answered, that sort of thing. But if not all of the questions have been answered for, say, section A, then A is going to be listed here until you've answered all the questions in section A. Once you do, you'll notice that section A will drop off of the completion requirements, same for B, C, and so on. If you're working in the GPRA and you need to exit out of it, or you need to just like lock it so you can step away and then come back and work on it again in a few minutes, there is a done editing button up at the top of the assessment that you can click on. That'll lock this screen down so that the questions can't be answered. And then once you're ready to start working on it again, the done editing button will change to edit. You just click edit, and now you can start answering those questions again. In many cases, the questions that you answer are going to be pretty straightforward, but we just want to make you aware of some things. So when you're working on the GPRA assessment, if the client refuses to answer some of the questions, so in this case, it says like client refused to answer substance use questions. If that's a yes and you select yes, then any follow-up questions in the assessment with regards to substance use will automatically get marked as not applicable. So you won't have to then go in and mark every one of those questions that the client refused to answer as not applicable, which will automatically do it for you. Also, as you're working on the GPRA assessment, If you answer yes to certain questions, there'll be a follow-up that then has to be answered. Mainly, you're going to see this whenever it's talking about medications. So, for example, diagnosed opioid use disorder. If my client's been diagnosed with an opioid use disorder and then a medication had been prescribed to them, then WITH is going to expect you to state which medication was prescribed to them and how many days in the last 30 days that they've been on it. All right, so in this case, like I said, that methadone was prescribed and that they've been on it for like the last 10 days. Same with any of the others. So like if that's the only medication that they were prescribed for opioid use disorder, there are still other medications that can be prescribed. So in that case, you would have to choose no for each of the other medications underneath opioid use. But at least one of those medications has to be selected yes, and the number of days answered as well. So just be aware of that. If the client says no on some questions, then the follow-ups could be marked as not applicable also. So in this case, if the client has never been diagnosed with, say, a tobacco use disorder, then any follow-up questions regarding tobacco use will be marked as not applicable because the client doesn't have that problem. Next, you've got missing data. So if you go to ask questions, ask the client questions and they don't have that information, and you say missing data, if there are any follow-up questions with regards to that question, so in this case, like have you ever been diagnosed with a mental health illness? If you say missing data on that, then the follow-up questions regarding mental health, like the self-reported mental health illnesses, will get marked as not applicable. Section B, very long section. Towards the end of it, there'll be a section on planned services. Something to keep in mind with planned services is this. It'll have different groupings of services. So like treatment services, and there'll be several services listed underneath treatment services. Same with case management, medical services, and that sort of thing. At least one service has to be selected. Doesn't mean that one service has to be selected from each group. Just one service out of all of these groups has to be selected. Obviously, if the client's receiving multiple services, you would want to choose each of the services that the client will be receiving. But just be aware, like you don't have to choose a service underneath each group. You just need at least one service selected out of all of these groups in order to satisfy the completion requirements. Okay. If the client's not receiving services underneath that group, then you'll just choose the box not applicable. So if they're not going to be, say, receiving any medical services, then you would choose not applicable underneath that list. After that, like, those are like the special case questions. Most of the other questions that you guys come across, like I said, are going to be pretty straightforward. After you finish completing the assessment, down at the bottom, like, so once all of your completion requirements are met on the right-hand side, you'll be able to scroll all the way to the bottom of the assessment, and you'll see this complete button. If you don't see the complete button, then you haven't fulfilled all the completion requirements on the right-hand side. Clicking complete, which will ask you to confirm that you want to complete and lock the assessment. You'll click OK. And then once you do, it'll say that the assessment's been completed. You'll know that it's completed because you'll have a timestamp as to like who completed it and when. And the lock button, or I'm sorry, the complete button will be replaced by the unlock button. So now you'll see an unlock button. The GPRA does need to be in the complete and lock status in order to transmit to SPARS. So just know if you don't complete the assessment, it won't transmit to SPARS. If you complete the assessment and then for some reason turn around and unlock it, then it won't transmit to SPARS either. So it does have to be completed and in the lock status, and you'll know it's in the lock status because the assessment at the bottom where it says complete assessment will say unlock. If it says lock, then the assessment's currently unlocked and you need to lock it so that it will transmit to SPARS. Okay. Just something to keep in mind that they wanted me to point out is that the GPRAs, there's been a change with SPARS, like how the data is transmitted to SPARS. The data is now being transmitted in what we call a CSV format to SPARS. Those records have generated some new validation errors that we've never had in the past. So just be aware of that, like as you guys start completing the new SOAR 4 GIPRAs and those get transmitted to SPARS, there might be some new errors that you're not used to seeing that you guys might have saw in the past and knew like right away like what the fix was for them. But like we are working with SPARS, like WITSs as well as the states. We're all working with SPARS to like figure out what those new validation errors mean and what steps need to be taken to address them. So yeah, so if you guys get back any validation errors and you're not sure what the fix is, just let your state admins know, and then if they need to, they can always reach out to WITS for us to figure out like what needs to be done to correct it. Okay. All right, so where are we? Here we go. All right, so here we are. Let's take a look at the GIPRA itself. So here we are. We're back in the GIPRA assessment. I've got these different sections over on the right, on the left-hand side, as well as my completion requirements on the right. I'm going to go through this like really quickly. Like I said, most of these questions are going to be pretty basic. Like it's asking like what the client's date of birth is. You can click the calendar icon and then choose it. Me personally, I find it easier to just say, type in the person's date of birth. Just make sure that you put in like the little slash symbols whenever you're typing in date of birth. And then it also asks, so it asks you to enter in the client's date of birth, and then it asks you if the client refuses to answer that question. So if you put in the date of birth, make sure you click that they did not refuse to answer it. If you click yes, it'll actually wipe out the date of birth field, and then you have to go in and re-enter it. So just make sure you click no. And then, you know, answering the other demographic questions. If you say, like right here, it says, are you Hispanic, Latino, or Spanish origin? If I say no, the follow-up questions that ask me to identify my ethnic group automatically gets marked as not applicable. So chooses race. Do they speak any other language at home? Again, if I say no, then the follow-up questions regarding the languages will get marked as not applicable. Real quick, Alicia is asking, we have a few clients whose social security number are coming up as not a unique social security number. Who do we contact to get that figured out? My guess is probably your state administrators. So like Ella, I'm thinking Ellen or Jaquetta. It looks like Ellen's answering. But yeah. But yeah, so you'll just continue answering all of these questions. If you, again, as you answer some of them, if you, depending on how you answer it, it might negate the follow-up questions for them. So just be aware of that. We'll say yes. All right. Section B, let's take a look at section B because that's the longest one. That's the one that's got the most questions in it. And the ones that typically gives people, I think, trips people up the most. So where it says client refused to answer substance use questions, again, if I say that they refuse to answer this, all of this information that it's going to ask to capture information on like their alcohol use, opioid use, that sort of thing, all of it gets marked as not applicable. So whenever you say, so if I say yes, then all of these follow-up questions regarding this gets marked as not applicable. So make sure that you're not saying yes if they, like, if they just say that, like, they don't want to talk about their alcohol use or whatever, but they're willing to talk about other things, and you want to capture that information, right? Otherwise, you know, if you say yes or if you say no for those, then each of those sections do need to be completed. So like you could say no, that they've not used alcohol or any other type of alcohol. And by typing in like the number 0, so like it asks you like alcohol number of days used. If they say 0, then the follow-ups with regards to like the type of alcohol and that sort of thing, or how they, you know, how that drug's administered, get marked as not applicable. Also, something to keep in mind too is that it says number of days used. If you click on it, it's supposed to be like in like the last 30 days. So we'll say, you know, if I say like that they've used opioids 10 times in the last 30 days, and that's what I would type in that field. And then like the route of use, and then any of the other, like, again, it's going to ask you to like go through all of the different types of opioid use, that sort of thing. Same with cannabis, sedatives, cocaine, all of the and other stimulants, all of that's going to be asked. That'll need to be completed. And then I want to just scroll down real quick and show you some of these other things. So like alcohol, diagnosed alcohol use disorder. We'll say no for this one, but let's come down to opioid use and say that they were diagnosed with having an opioid use disorder. So if I say yes and that a medication was prescribed, again, I do have to say which medication that they're taking. If I say no on all of these, then the completion requirements for Section B will not go away because it is expecting you to identify at least one medication that they've been prescribed and that they're taking. If you said that they were prescribed the medication, then a medication has to be listed. Just keep that in mind. Otherwise, the completion requirements will not show as complete for this client or for this section. So we'll say,
Scott, will you go back
yep,
one screen?
absolutely. Where to?
The diagnosis. So here, so to have SOAR funds, they either have to have an opioid use disorder, it doesn't have to be primary, or they have to have a stimulant use disorder diagnosis. So just making sure that you're going to have, and more likely than not, they're going to have an opioid use disorder. So yes, here. So
Okay.
just make sure that we're being really clear about that. And on the medication one, if you're a recovery service, so you're not a prescriber of medication and you're not seeing them for the treatment of the OUD, so you're not seeing them for medication, that piece of it, then you're saying no to this. Even though if you know that they're on methadone, they're on buprenorphine, you're not the prescriber because you're not going to be able to answer the rest of the questions about how often they're given and stuff. So you want to say no here because that's not your program. But if you're an OTP, then your answer is yes, and then you'll be able to answer the medication question.
Thank you, Ellen. That's very helpful.
Yeah.
Good information.
And the long-acting medication that Jill's asking about, so it's a long-acting injectable.
Mm-hmm.
I don't know where it is. What's on the next page? Is there another?
Let's scroll down. Let's see.
Yeah, so it's the no, that's extended release naltrexone.
Yeah.
There's
no other option.
Brexity is a buprenorphine product. So this is asking about buprenorphine, not Suboxone. So you can do it as a buprenorphine product.
Awesome. Good question.
And then the number of days would be if it, I can't remember how long that one lasts, but if it's 28 days, if it lasts 28 days, you'd put 28 days.
Cool.
Thanks, Scott.
Yeah, absolutely. Good questions. Appreciate it. But yeah, so like Ellen was saying, for the funding, you would want to identify at least like one opioid use or stimulant, or maybe even both, in the GIPRA. So we're just going to scroll through. I'm not going to complete the entire GIPRA. It would it would take us too long. Just want to show some of these different sections. But yeah, so self-reported mental illness. This is where the client can say whether or not they've been told in the past that they have these disorders. There is a question before it, so it asks like, have you ever been diagnosed? If the client says no, that they've never been diagnosed, then the mental health section, you'll notice, immediately gets marked as not applicable. If they have been diagnosed, then they would just choose which ones or identify which ones and then mark the others as not applicable. And then, of course, there's also the option of whether or not you guys provided screenings or co-occurring screenings for mental and substance use disorders, that sort of thing. Plan services. So plan services, when you get down to this section, it's going to ask you to choose the modality that the client's going to be receiving. Only one needs to be chosen, but at least one modality does need to be chosen from this list. If they're going to be in more than one modality, you can certainly check those additional modalities, but at least one needs to be selected to meet their completion requirements. And then, like I said, here's those treatment services groups. So underneath the modality, you're going to see the different groups. So treatment services, case management services, and so on. Out of all of these, only one service from all of these different groups needs to be selected. But if the client's going to be receiving multiple services, or you're going to be providing multiple services, you would want to choose all of those services that they're going to be receiving. But just know that only one out of all of the groups total needs to be chosen in order to meet the completion requirements. All right. Living conditions, as you can see, very short. There's only like 2 questions that are here. Education, and employment, and income. Again, these questions are all pretty straightforward. You'll choose, whether or not they're employed, how much education they've received, and that sort of thing. The only question that I see that sometimes people seem to skip over is down at the bottom, the very last one. It says, what is your personal annual income? Just make sure that you're answering that question. I see that gets skipped a lot, so then that completion requirement doesn't go away. Legal. So again,
let me just add, I know we don't like to ask about their income level, but in this case, you don't necessarily have to ask it in a is you have this answer because you know that they've qualified for SOAR funding already, so that puts them in a certain level. So you may actually have this information if you don't feel like you need to ask in a clinical setting to do that. So just there's 2 ways to get the answer to this question. So you have options.
Awesome, thank you. And then legal, again, the questions are pretty straightforward. You would just go ahead and answer those. And then mental, and section F, where it talks about mental and physical health problems, treatment recovery, in which case these actually do need to be answered. So it's going to ask you, like, how would you rate your quality of life over the last 30 days? I think even if you select refuse, so the next section where it asks you to say, like, have you ever experienced these symptoms? You still have to put in an answer. If the client says that they've never experienced serious depression, then you would just put in a 0. You can't leave that field blank. So just be aware of that. So if the client's never experienced that symptom in the last 30 days, then you're just going to put a 0. Otherwise, you'll put in like how many days that they've been feeling that particular symptom, and then just go from there. You'll notice I'm skipping through these real quick. And the way that I'm doing that is I'm just hitting the tab key. So like I put in my data in the first field and then just hit tab 2 times, and it'll jump me down to the next field, and then I can answer it. Just a quick way, little tricks that I've learned to answer some of these questions more quickly. All right, so then we'll skip these other questions, but yeah, it's going to continue asking you these other questions. In the past 30 days, I think this field is kind of new. In the past 30 days, before, like I think you had to answer these a certain way. Now you can choose like whether or not the client sought primary care provider and urgent care, or maybe they've not sought any care at all. But there is an option. This question now has been changed so that you can select multiple options instead of choosing each one individually before. Do they have health insurance? And then if so, then which insurance do they have? Social connectedness. Again, these questions are pretty straightforward. And then that's section G, that's the last section. So once that's all done, the complete assessment down here at the bottom, you'll see that you'll have that complete button. I don't, because I didn't answer all the questions, but if all the questions had been answered, would see that complete button, and then I could complete it. It would ask me to lock the assessment, and then once I click OK, the assessment's locked, and then it'll transmit to SPARS overnight, typically. Any questions about completing the GPRA? Or any other questions, I should say? So let's talk about consent and referral. In some instances, you may have clients that need treatment. Maybe it's services that your agency doesn't provide. In that case, you can create a consent record for that client and then refer them to another agency for treatment. To do that, you'll go to the consent screen for that client, create a new consent, and on the client disclosure agreement screen that displays, you'll fill out at the very minimum the required fields. You'll notice on that client disclosure agreement, it does ask you to identify which agency that you're wanting to disclose the information to. So you would need to know ahead of time, like which agency that you're planning on sending that client to for treatment. Okay. So you'll choose the agency and facility possibly that you're sending the client to, complete the other required fields, and then the client information to be consented section. This one is, you've got an expiration type that you're going to select. I believe it's typically for you guys, I think it's date signed, and then the number of days, you'll put in the number of days after the date signed that information is going to be shared with the agency that the client's being referred to. And then underneath that, you've got the client information options. Something to keep in mind whenever you're putting in the information for the client information to be consented is you have to enter in an expiration type and enter in the number of days before you select your client information options. If I don't type in the expiration type or the number of days, and then I just start trying to move over information that says client information options from the left-hand side to the right-hand side where it says disclosure selection, then WITS is going to throw an error at you and tell you that the expiration type and days has to be set first. Also, you'll notice too that in the client information options, there's several options that are listed here. A lot of them you probably want to, or that you're probably going to want to consent to the other agency. In which case, if you hold down the left control key and click on those different fields, then you'll be able to move all of them at the same time. And I do recommend that, which I'll show you in the demo, because if you don't, after you move one piece of information from the left-hand side to the disclosure section on the right, the number of days field zeroes out, and you have to re-enter it again to move to share any other information for that client. So recommend that you move all of your data that you're going to be consenting all at one time. Once that's filled out, you'll just click the Save button. And then once the client disclosure agreement is created, you save it, you can then use that disclosure to create your referral. So there'll be a button that displays up at the top of your disclosure agreement that says create the referral. You'll click that button and it'll open up the referral screen, and you'll need to complete this. If you use the button from within the consent form, then a lot of this information will get filled out for you automatically, and you won't have to re-enter it. So I highly recommend using the referral button from within, or the create referral button from within the consent form to create your referral. So then you'll just complete the other required fields, and then once that's all filled out, you'll just click Save and Finish to finish creating the referral. At that point, once that referral is created in WITS, whoever is at the referring agent, the agency that's going to be receiving that client referral, they're going to get a message on their home screen. So at that first tile where it's got your name and the day's date, there'll be a message that pops up that says that they've got clients waiting to be referred in. All right. And then for those agencies, then they'll just, to accept that referral, they can go to the agency screen from the left navigation menu, And then underneath agency, they'll click agency list to expand its menu options, and then they'll see referrals. They'll click referrals to expand that, and then they'll see referrals in, and then they can do a search for clients that have been referred, and it'll display in the list section. To accept that referral or to reject it if that's going to be the case also, you'll just hover over the vertical ellipsis to the right of that referral and then click review. That'll take you back into the referral screen, but this time from like the referring agency from the agency perspective of the client or of the agency receiving that referral. And then they can just choose, if they're going to accept it, then they can set the referral status date to like place accepted. They can also record any appointment information. So like if they had an appointment with that client, they can put in like when that appointment was, what that appointment date was and whether or not the client kept the appointment or not, that sort of thing. But if they're going to accept it, then you just choose the referral status of place accepted and then just click save and finish. And then at that point, the client record will get created in the new agency, and then that agency can go from there to like enroll the client in their programs and that sort of thing, and provide the treatment. All right. So let's take a look at a referral. All right. Let me exit out of this, and actually let me pull up a different client real quick. There we go. All right. By the way, I don't know if you guys notice, you can quickly go back to the client list screen. So like if you're inside of a client record and you want to pull up a different client, you can go to that client list screen real quick by just clicking on the X button up in the top right of your client ribbon. So click on that, it'll close the client record that you're currently in and then take you back to the client list screen. So then you can search for a different client. So let's search for Mrs. Danvers. All right, so we did a search for Cara Danvers. If I hover over the vertical ellipsis and then click activity list, it'll take me into Cara Danvers' record and immediately take me to the client activity list. I chose the activity list because the consent information, like the consent screens, is underneath activity list. So by selecting activity list, it automatically takes me to the activity list screen and also automatically expands the submenu for activity list. So then I just scroll down till I see consent and click on it. And then it'll show me if any consent records have been created for Cara in the past, they'll be listed underneath the client consent list section. Otherwise, to create a new consent form or consent record for that client, I just click this button that says add new client consent record. That'll open up the client disclosure agreement. Again, I'm just going to hide the context just to give me some more real estate. It's going to ask me like which agency am I disclosing the client's information to. So maybe we're doing it to the Alcohol Drug Council of North Carolina. And then the purpose for the disclosure, we'll put in what those comments are, the earliest date that they can be consented. We'll say today's date. Has the client signed the paper agreement form? So, if you guys you have that client consent form that you provide to your clients that they sign to say that they're consenting to have their information released to another agency. When you have that, you select yes, put in the date that form was signed, and then you come down to the client information to be consented section. So you've got the expiration type. Like I said, I think you guys choose the date sign in most cases, and then like however many days that is, we'll say like 30. And then which information are you sharing to the new agency? So in this case, Alcohol Drug Council of North Carolina. So you'd select which bits of information are being consented. And then again, I held down the left control key and then I can click on each of those options that pieces of information that I'm consenting. And then I can click the arrow to move it over to the disclosure section. And then once that's all listed in the disclosure section, I can just click save to finish saving this consent form. Okay. So I'll click save. And then, like I said, you'll see that this create referral using the disclosure agreement button will display. So I click this and it'll take me immediately to the referral screen. And then I just finish filling this out to create that referral to the new agency. So let's look at the refer to first. So it's got the agency listed, but I do need to choose the facility. So at that point, I'll choose the facility that that I'm sending them to. Then you'll see a list of programs that I can choose from. If there's multiple, then I'll choose the program from the dropdown. If there's just the one program for that facility, then it'll automatically choose that program for you. Drop down for the reason on the left-hand side, I'll choose what that reason is. Service is not available, we'll say. Was the consent verification required? Was the consent verified? And are we continuing the episode of care or not? And then the referral status, you'll see that it automatically says referral created / pending. So we'll just leave that set, and then we'll just click save and finish. And then that creates, oh, I chose an agency that didn't have the right program. But yeah, but at that point, it will create the referral. But just, this is good to know though. So if the client is enrolled in like a SOAR program at your agency, and you try to send them to an agency that doesn't have SOAR programs, then WITS is going to throw an error at you and say, just like let you know that, hey, you're trying to send this to this client to an agency that doesn't offer SOAR programs. So just be aware of that. Or it could mean that you've chosen the wrong program from the dropdown as well. So you'll want to make sure that you're sending this client to the appropriate agency, and that you've got the appropriate program selected as well. Let me back out of this real quick. Let's see. No. I didn't think to check to see which agencies, but that's all right. Once your client has been referred to another agency, like I said, at that point, the agency that receives the referral, they're going to on the homepage first, they're going to get a message on their homepage that says that the client's been referred in. So in that first bar, they'll see that a client's been referred in, or waiting to be referred in. So they would go to agency from the left navigation menu, and then underneath agency, if they scroll down the agency list, they'll see referrals. And then underneath referrals in, they click on that. It'll take them to the referrals in search screen, and then they can search for clients that have been referred in and click the search button. If the client or if that agency has received any referrals, then they'll be listed here. At that point, they can go into that referral and then accept that client by changing the referral status to place accepted. When that happens, WITS will automatically navigate to the client list screen, and the client's record will become active, and they'll be on the client, and you'll be on the client profile. So like WITS will automatically create the client profile for you at the new agency for that client, and then at that point you can go and like create the intake at your agency for that client and enroll them in programs, and then go from there. Okay. Any questions on referral? So you've got that initial intake that was done. The client's been receiving services, and around the 5-month mark after that initial GPRA was completed, the window is going to open for you to complete a 6-month follow-up for that client. The window for the 6-month follow-up is between 5 and 8 months. So the window opens 5 months after the intake was completed, and it closes after 8 months after the end of the 8th month from when that initial GIPRA intake was completed. To help you guys with managing those GIPRAs, there are a couple of screens, such as like the GIPRA follow-up due summary and the GIPRA follow-up due detail screens. So from the left navigation menu, if you click agency and then underneath the agency menu, you'll see that you have these two screens are available to you: GIPRA follow-up due summary and GIPRA follow-up due detail. Clicking on the follow-up due summary screen will take you to what's called the GIPRA follow-up due interview due summary search screen. And then you can search for what this screen does is it shows you for the grant that you search for. So you do have to choose which grant you're searching for. But once you choose that grant, it'll show you like the status of all the GIPRAs and whether or not those status, like how many GIPRAs you have in a compliance status, how many are in a due status, maybe a miss status, that sort of thing. To the right of each of these statuses, you'll see that you have a vertical ellipsis. Hovering over it, you'll see an option that says review. So if you click that button, it'll then take you to the GIPRA follow-up due detail screen. You can also just navigate to the GIPRA follow-up due detail screen, and then you can do a search for particular types of GIPRAs. As far as these statuses go, this is here's the definition for each of those statuses. So you've got the new status. So this means that the GIPRA was the initial GIPRA was just recently created. Due means that 6-month follow-up GIPRA is due and that it's within the 5 to 8 month window. If it says missed, if you have GIPRAs in the missed status, then you've missed that 5 to 8 month window. Compliant, so that's going to be that's for 6-month follow-ups that were completed within the 5 to 8 month window and the interview was completed. So that is something to keep in mind. The compliance status, in order to be considered compliant on that 6-month follow-up, the 6-month follow-up needs to be completed within that 5 to 8 month window, and the interview needs to be completed. Okay. If either of those is not met, then the GIPRA will be considered non-compliant, which is the last example. So that means that the 6-month follow-up was not completed within the 5 to 8 month window, or that the interview was not completed. Okay. And as Ellen is pointing out, so like my slide examples say SOAR 3 for like whenever it's showing the search, but you guys are in SOAR 4. So at this point, like when you guys go to these screens to run your reports, you're going to want to search for the grant that says SOAR 4 now. Okay, so just be aware of that. GIPRA follow-up due detail screen, and I'll show you guys whenever we get to the demo. There is a new field that will display, or I'm sorry, a new column that's going to display underneath the GIPRA follow-up due interview detail section. But on the GIPRA follow-up interview due detail search screen, again, you've got to search for the grant. So you've got to choose which grant you're searching for. So now it's going to be like SOAR 4, but in the past it was like SOAR 3, and before that SOAR 2 and so on. The status that you guys are probably going to find the most helpful is the status that says within window. Within window is going to be the default status. You can change it on the GIPRA follow-up due to like any of the other statuses of the GIPRA, or I should say follow-up GIPRA. But within status, if you select that and then you click search, it's going to show you all of the GIPRAs that are in that 5 to 8 month window. In this case, if you do see any GIPRAs that show up as red in that 5 to 8 month window, then it means it's past that 6-month due date, but that the GIPRA is not out of compliance yet. It's basically just warning you that, hey, you're getting close to missing that window for that 5 to 8 month follow-up.
And okay. Scott,
yes,
Jaquetta reminded me. So we are in that time period where we do SOAR 3 and SOAR 4. And so currently they may be doing SOAR 3 follow-ups. So they actually can use this screen for SOAR 3 and SOAR 4.
Right.
So to do that, but I just want to make sure folks are very clear about which one you're looking for. So as you plan out, it'll be SOAR 4, and then SOAR 3 are the ones that we are actually in on the follow-ups, finishing up SOAR 3 from last year. And those will be done by April.
Awesome. Thank you.
Correct myself. Thank you.
No worries. All right. All right. So 6-month follow-up. So whenever you go to create the 6-month follow-up assessment, you're going to go to that GPRA assessment screen, click the new assessment button. The interview type dropdown that you're going to choose is going to be the 6-month follow-up. And then when you select that, it's going to ask if you conducted the interview or not. So depending on which of these options that you choose, there's going to be different questions that you need to answer on the assessment. If you say that the interview was not done, then there's only one field that'll need to be completed, and that's the follow-up status field or section. If you say that the interview was conducted, you'll need to complete that new field, so the follow-up status field, as well as answer all the sections from the initial intake again. So like sections B through I think G, or I think it's G, where it asks like their substance use and mental health and all that. All those questions will need to be answered again. Okay. Then you'll put in the assessment date, program, and then click save. If you didn't conduct the interview, then it's not going to ask you for the assessment date. So, because that's the date that it's asking for, like that's like the date that the interview was conducted. All right. So I'm just going to show you guys the new fields in this case. The other fields or the other sections of the GPRA we already discussed, but this is the new section that you're going to see in that 6-month, which is the follow-up status, and it's going to ask you, was the client able to be contacted for a follow-up? If you said that the interview was performed when creating the assessment, then you're going to want to select yes, that the client was able to be contacted, and then you're going to say, and then you're going to choose like answers 11 or 12, that the GPRA interview was completed within a specified window, or that it was specified outside of the window. If you weren't able to complete the interview, then when you choose no, you're going to choose one of the other options as to like why you didn't complete the assessment, such as maybe the client was deceased, maybe they were incarcerated, that sort of thing, or maybe they moved. If you say that the interview was not done, then the GPRA is considered to be out of compliant, except for if the client was deceased. So if the client passed away before the 6-month follow-up could be done, you say that the interview wasn't conducted because they were deceased at the time of due date, then in that case, the GPRAs won't be considered to be non-compliant. But any of these other reasons, the 6-month follow-up will be considered as non-compliant by SAMHSA. Okay. All right. So, whoops. That's not it. My apologies. I don't know why it's not pulling my screen back up. There we go. All right. Here we go. All right. So as I was saying, there are some reports that you have available to you to help track those GPRAs, the 6-month GPRA follow-ups. If you click agency from the left navigation menu, you'll see that you have, where is it? Scrolling down, you'll see where it says GPRA follow-up due summary and GPRA follow-up due detail. The due summary is, I mean, this screen can be helpful, and just like at a glance, it'll tell you, so if we choose like SOAR 3 as our grant and then click search, it'll tell us like how many GPRAs were in a non-compliant status, how many were in a compliant status or in a due status, that sort of thing. Not quite sure why it's not giving. Oh, I know why it's not giving me any detail. I forgot everybody's on the same. Here we go. So in this case, I'm just going to do SOAR just so it shows you guys number of compliant, number of missed, so that you'll see some options. But yeah, so And again, if you hover over the vertical ellipsis for each of those statuses, you can select details, and it'll take you automatically to the GIPRA follow-up due detail screen and show you those GIPRAs. So then you can, from there, you can like access each of the client GIPRAs to, review the GIPRA or start that 6-month follow-up if it's not been done yet, that sort of thing. Otherwise, if I just go to the GIPRA follow-up due detail screen, again, put in my search parameters. The status is automatically going to default to within window. I can change that to another option if I want to, if I'm looking for GIPRAs and other statuses, that sort of thing. Otherwise, in the grant field, you guys are going to choose either SOAR 3 or SOAR 4. For the training purposes, I'm just going to choose grant or SOAR and then click search. When I do, I should have pulled up. Why didn't it pull up? Missed. Is she out of? Oh, she is out of window now. I forgot. Yeah. So whenever I created my examples, I forgot that the new month was rolling over, and then the new month kicked her into the missed status section. But yeah, so you do a search. So we'll say that like this was in the within window status. Cara Danvers was supposed to show up in the within window status, but that she was in red because she was in danger of missing the window, that 5 to 8 month window. But then I could hover over the vertical ellipsis for that client and then click view. When you do, it'll automatically take you into that client record so that you can then navigate to the GIPRA assessment screen and do that 6-month follow-up. Same for like any of these others. So like even if you have clients, I guess, in the missed status, you could still go and access them and do that GIPRA that 6-month follow-up, and capture that information. But yeah, doing the within window, especially if you guys do this on a regular basis, it'll help you guys not miss that window so that you're staying in that compliant record or that compliant status for your GIPRAs. Because again, this is going to, so like when you do a search for a client or search for the 6-month follow-up within window, as soon as that client becomes available in that 5 to 8 month window, as soon as that 5-month hits for that client, they're going to show up in this list. So you guys can start reaching out to the client to complete that interview. So just something to keep in mind. So I can either go to the client list screen and search for my client, or I can access them from from my report. Again, hovering over the vertical ellipsis and clicking view. And it'll automatically take me to the GIPRA assessment search screen. And then I can see here's my initial intake that was completed. To create the new GIPRA assessment, I'll just click the button that says create new GIPRA assessment. It's going to ask me to choose the interview type. I'm going to say 6-month follow-up. In this particular case, I'm just going to choose no, that we didn't conduct the interview. Notice the assessment date goes away. And then for the program, I choose which program the client was enrolled in and then click save. It's going to ask, are you sure you want to create the 6-month? We'll click OK. And then if I had said yes, like I said, sections B through G that were in that initial intake would be listed on the left-hand side. All of that information would need to be entered in and updated. Otherwise, the only section that you're going to see is the follow-up status. So we scroll down the follow-up status. Were we able to conduct the was the client able to be contacted for the follow-up? In this case, I said that we didn't conduct an interview, so we'll say no, and then we're going to choose why. Maybe they moved. So we'll say that they moved. We weren't able to contact them anymore. And then is the client still receiving services? Yes or no? I'm going to say no. And then you'll see if you scroll down to the very bottom that the GIPRAs can be completed. You'll also notice that the requirements on the right-hand side also disappear. So that lets me know that everything's done and that I can complete the GIPRA that 6-month follow-up assessment. So just click complete. It'll ask again, are you sure? Click OK. And now the GIPRA gets locked down. If I scroll all the way to the bottom, I'll see that timestamp that lets me know who completed it and when. And now that GIPRA will get transmitted to SPARS in the next batch that gets sent over. Any questions about the 6-month follow-up? Obviously, this is not the option that you're going to want to do. You're going to want to try and complete that interview every time. But for the sake of like time and everything else, we skip over doing like showing you those exact same questions that were on the initial. But just know sections B through G, just like from the initial, will be listed, and you'll have to answer all of those again. I think the only part of section B that doesn't display is that it doesn't ask you to select which services they're receiving. All right. All right, so discharge. So once their client is no longer going to be receiving services, you're going to do that. You're going to discharge the client from your agency. The first thing that you're going to want to do is complete that 6 month I'm sorry, not 6 month, that discharge for that client. There is also a report available to you again from agency. It says GPRA discharge due. I'm not sure how useful this report is for you guys though, because you only use WITS for recording the GPRA. You don't use it to record any other activities such as like treatment, recording encounters and that sort of thing. And the reason why I say that this report may not be as helpful to you is because if WITS does not detect any activity on your client, then it's going to assume that client's ready to be discharged. So, you do that initial intake of the GPRA, enrolling them in the program and everything else, but then you don't do anything else on them for like 6 months, then WITS is going to think that they're not ready for the 6 month, but not only are they going to be ready for the 6 month, but maybe they're also ready for the discharge. So you might see your clients pop up here as well, even though they're not really ready to be discharged. So just be aware of that if you do use the GPRA discharge due screen. Otherwise, on that GPRA discharge assessment, when you go to create it, you're going to choose discharge for the interview type. Again, it's going to ask you if an interview was conducted or not. If you say yes, you'll see that when you go to create the assessment, it's going to ask you, do you want to pull the data from the 6 month follow-up? If you say yes, then sections B through G that were completed in that 6 month follow-up will get pulled over into the discharge assessment for you. So you don't have to go back and like capture all that information again, update it as needed, but otherwise like all of that information will get filled out for you automatically. Okay. Otherwise, if you say no, the only parts of the discharge that would need to be completed would just be sections J and K. If you say yes that the interview was completed, then B through G as well as J and K will all need to be completed for the client. But if no interview was conducted, then just sections J and K will need to be completed. Day sessions required. So for the most part, like again, sections B through G, that's all pretty standard. J just asks about like the interview itself. The sections K, this is whenever you get to section K, it's going to ask you to enter in the modality as well as the services again. But now it's asking you to enter in how many days or how many sessions of that modality or that service did they receive. So if you say, for example, that the client was in an intensive outpatient treatment modality, it's going to ask you how many days was that client in that modality. And then whenever you get down to the different services and you say that the client received, say, medical care, it's going to ask you how many sessions of medical care did they receive. So just be aware that whenever you select the modalities and the services that the client received, it's then going to ask you like how many days they were in that particular modality or how many sessions of treatment that they received. Real quick, Maria is asking if the patient is still in treatment, will we still discharge them at 8 months? I understood we do an initial 6 month and the discharge when they complete the treatment. Correct. So I mean, if the client is still in treatment at 8 months, and then you're not going to do that discharge at 8 months. They'll stay in. You'll continue to offering them treatment until they're ready to be discharged. Yeah, sorry if I the 5 to 8 month window that I was talking about earlier only has to do with the 6-month follow-up. That's just saying that, yeah, the client's receiving services. They've been receiving services for us for the last 5 to 8 months, and we're just doing this assessment to say this is their progress now. This is the information that we have on them now. That sort of thing. Yeah. Discharge is only going to be done when the client's actually done with the treatment and is ready to be discharged from your agency, from that program.
But I just wanted to reiterate, Scott, on that one, and I'll put it in the chat as well, is if the person discharges from your agency at 2 months, they are not discharged from the GIPRA. You still have to try to get that GIPRA at the 5 to 8 month mark. So those are two separate things. You discharge from your clinic, but they don't discharge from SOAR, because once you enroll them, you commit to doing that intake and that 6-month GIPRA.
Yeah. Let's see. And then Neil's asking, would a client referral be entered in if the client is switching from an OTP clinic to another OTP, or do we discharge? Do you know the answer?
Yes. Okay. So you do a you want to refer them. So if you they go from one to the other, so you're the SOAR provider and you want to work with the next OTP to refer them to that agency. So that if you think about it from the client perspective, they don't have to do you don't want them to do another intake. You want to just do your intake GIPRA and basically, quote, send that to the new agency. And then again, once that person, I like to say, once they start on the SOAR train, they continue on that SOAR train. So you want to refer them to the new agency so that they can take over doing the GIPRAs and they have to do the follow-up. It's not on you to do the follow-up when they're in services at another agency that is providing them services through SOAR dollars.
Cool. Awesome. Thank you. Recovery planning services. So we just wanted to point out something. Oh wait, actually, sorry, I missed something. Let me go back a screen. So on the days and sessions required, whenever you're entering in the number of days or the number of sessions into these fields, the number can't be a negative number. So just make sure that you don't accidentally type in, like, say, -1 for the number of days that they were in a like an intensive outpatient treatment modality, which will throw an error at you. Also, that number can't be greater than 999. So a client can't be in, say, intensive outpatient treatment for more than 999 days if it's got to be between 0 and 999. If it is 0, just don't check the box. So if they're in that modality, check the box, and then like 1 through 999 is what you would want to put in. Any modalities that they did not receive or that they were not enrolled in, then you would just leave it unchecked. For the services, again, just check the services that they received and how many sessions that they received. And the only stipulation for this is that the number can't be a negative number. So just be aware of that. But yeah, so recovery planning services. So underneath section K, where it's asking you to identify services received under the grant funding, there are two groups of services. One is treatment services. The other one is recovery support services. They both have the service recovery planning. If these fields, if the client received recovery planning underneath either one of these, then recovery planning needs to be selected underneath treatment services and recovery support services, and the number of sessions entered in has to be the same. So if they receive 10 sessions of recovery planning, then recovery planning needs to be checked underneath treatment services and underneath recovery support services, and 10 has to be entered in order to meet requirements or validation requirements for SPARS. If you don't enter it, if you only put this in for one field, then SPARS is going to reject that GIPRA, the discharge GIPRA. So just be aware of that. That's one of the new validation errors that I mentioned earlier that we've been running into with how they're changing with how SPARS is looking at the data that we're sending them. So just be aware of that. All right. Once that GIPRA is completed, again, you'll click the complete button down at the bottom. That'll lock the GIPRA, and then it'll transmit to SPARS and then the next batch that we send to them. And then once that GIPRA discharge is completed, you can then start the disenrollment program. So at that point, you can go back to the program enrollment screen, hover over the vertical ellipsis, and click review for the program that the client's enrolled in. It'll take them to the program enrollment profile screen, put in an end date, and then choose a termination reason, and then click save and finish. Once the client's disenrolled from the program, you can then close the intake for that client. So the client's no longer going to be receiving any services from your agency, and you're not expecting them to come back for services. Then you can navigate to the intake, scroll to the bottom where it says date closed, put in the date closed, and then click the button that says save and close the case. Okay. Real quick, Brian's asking for clarity. When we are switching a client from SOAR 3 to SOAR 4, we are not discharging them from SOAR 3. Oh.
So switching is an interesting word here. You are finishing SOAR 3. So so finish means intake, 6-month follow-up, and discharge. So once those things are done, then you start SOAR 4. Let me know if that makes sense.
All right. And then let me pull up. There we go. Awesome. Okay, so let's go back into WITS, and we're going to do a discharge on one of our clients. So we're going to say that our client Tim Drake has been going through the program. They're done. They're ready to be discharged. Let's do a search, Mr. Drake. Find his record. Hover over the vertical ellipsis to the right of his record, and then we can click activity list. When you do, you can then scroll through the activity list submenu until you see GIPRA assessment, and then click on it to show the GIPRA assessment screen. Here you'll see that the initial intake was done, as well as the 6-month follow-up was completed. If they're ready to be discharged, then at that point, you're going to click this button that says create new GIPRA assessment. And it's going to ask you, again, choose your interview type. We're going to say discharge. Did we conduct an interview? I'm going to say yes for this. And then we'll choose today's date as the interview date, and then choose the program. When I do, it's then going to ask me, do you want to copy the data from the follow-up? So that 6-month follow-up, if I completed it, did the interview, then I can pull the information from the 6-month follow-up into my discharge, and then that will automatically complete sections B through G for me, and I just have to update the questions as I need to. Okay, so we'll say yes, and then click save. And it's going to say, are you sure you want to create the discharge GIPRA? We'll say okay, and then that'll create the GIPRA, that discharge GIPRA assessment for us. Real quick, Harley's asking, so just to make sure I'm tracking, if they are still receiving services, then we do not discharge them from SOAR 3 at all.
Yeah, back to that train metaphor. When you start on the SOAR 3, when they start on the SOAR 3 train, you stay there until they're finished with the SOAR 3 train. So that's intake, 6-month follow-up, discharge. So once you finish in SOAR 3, once you finish the 6-month follow-up, you discharge them from SOAR 3 and then enroll them in SOAR 4 the next time you see them. And that's when you do the SOAR 4 intake and you start on the SOAR 4 train. Thanks for that question.
Yeah, good questions, guys. All right, so here's our GIPRA assessment. you'll notice completion requirements on the right-hand side, sections B through G. Like I said, that information automatically gets pulled from the 6-month. So the completion requirements will automatically show that those sections have been completed for me. If I do need to go into sections B through G and modify any of that information or update it, I certainly can. Otherwise, if all of that information is correct, then I just go down to discharge and then I complete sections J and K, and then that's it. So, excuse me. So discharge status, it asks us to choose what date the client was discharged. We'll say today's date. Did they graduate or complete it, or was it terminated? If you say that it was terminated, then you do have to select a reason for termination. If they completed it, then you'll notice that the reason for termination gets marked as not applicable. And then you just answer the other questions like, was an HIV test ordered or provided by another provider? Were they provided with naloxone or fentanyl test strips, or both? And then, were they vaccinated for COVID-19? Yes, no, partially, or no, not at all, or refused, that sort of thing. Once you answer those, again, completion requirement is going to drop off, and then you come down to section K. And then section K, like I said, you're going to choose which modalities the client was enrolled in, and then which services they received. So we're just going to say, like in this case, that they were only in intensive outpatient, and then maybe they were in the treatment or in that modality for 90 days. And then we come down to the sessions, and then we've got treatment services. Again, like I was saying earlier, recovery planning. If I say that they receive recovery planning here underneath treatment services, then I also have to go down to the recovery section, recovery support services, and then select recovery planning here as well. And then whatever I put in one field has to match the other field as well. So if I say 10 and that they receive 10 sessions underneath treatment services for recovery planning, then underneath the recovery section, I also need to say that they receive 10 sessions of recovery planning. Any other services that they received, I would check the boxes and then enter in the number of sessions that they received. If they receive no services in that section, then I'm just going to choose not applicable. So we'll just say not applicable for everything else. Obviously, the client's going to receive more services than that. Did the client attend 60% or more of their planned services? Yes or no? Did they receive any services via telehealth or virtual? And then, you know, like if they were diagnosed with opioid use disorder, if you say yes on these questions, then again, it's going to, like, at this point, it's going to ask you like all those substance use disorder questions. You've got to answer them all over again, and like what medications were prescribed and that sort of thing. Otherwise, if you say no, it'll mark those questions as not applicable. I'm just going to mark them no real quick just to get through this. But obviously, you guys would want to say yes. Oh. And then I still missed something. Oh, no. There we go. And then there's my complete button. Real quick, looks like we got a couple of questions that dropped in. So let's see. Dave is asking, a new GPRA intake will need to be completed for all SOAR 3 participants. Entering SOAR 4 is like a restart for all participants. All right, looks like Ellen just answered that. Jared's asking, feels like a lot to have to discharge. Oh, yeah. Would be nice if they had. Yeah,
Yeah, absolutely, Jared. I get what you're saying. Absolutely. So if you have to, I really do mean the separate trains. And so SOAR 3 is a completely separate legislative appropriation than SOAR 4. So it's like you could have named it, it's seen by Congress as a different program completely. So although it feels the same for all of us and for the people that we serve, it is different. So the people that we report to and the reports that go to Congress are, you made this appropriation for the next 2 and now 3 years. what did this specific grant accomplish? And so when you kind of think about it in those terms, it's that particular grant. And so that's why you get on one train and you have to stay on one train. And then when you get on the next train, you stay on that train. That's why they're considered so separate. But I hear you.
Yeah. So then at the bottom, like I said, you'll see that complete button. So we'll just click it. It'll ask, are you sure? Click OK, and then that'll complete the assessment for us. And then all right, there we go. The training instance can have like a little slight delay, so I apologize for that. All right, so the GPRA assessment's done. I can click the back arrow to exit out of the GPRA assessment and go back to the GPRA assessment screen. It'll show me all my GPRA assessments that have been completed. From that point, I can then click on client list to expand it and then go to program enrollment to disenroll my client in that SOAR 3 program or SOAR 4 program, whichever program they're being disenrolled from. If, and correct me if I'm wrong, Ellen, but like if my client is getting discharged from say SOAR 3 and then they're going to be enrolled in SOAR 4, then you would just disenroll them from the SOAR 3 program. So we'll put in the end date, termination reason, and then click save and finish. It'll take us back to the program enrollment screen. And then at that point, I can then just start and create a new program enrollment profile for the SOAR 4 program. So if that was SOAR 3, I can then come in here, add my client to the SOAR 4 program, and then go from there. So it's not like, so in that case, you wouldn't then go to intake and close out the intake for your client. You would just disenroll them from the SOAR 3 program and then enroll them in the new SOAR 4 program. Okay. If my client is completely done, then at that point, once I've disenrolled them from this program, then I go to the intake underneath activity list and then put in a date closed and then click the button that says save and close the case. And that's it. Now, and that will completely close out the client's record. Do note though that it does say whenever I try to click save and finish that if that client profile is still showing in the in progress status on the activity list screen, that missing information does need to be completed before WITS will let you close out the intake for that client. So just be aware of that. But otherwise, if everything was captured and I click save and finish, then the intake is complete or gets closed out for that client, and the client's completely closed out of the agency. Again, only do that, as my understanding, if the client is completely done. You don't expect them to come back for any services in the future, that sort of thing. Yeah. Let's see. Kelsey looks like has a question. We have discharged all our clients from SOAR 3 and enrolled in SOAR 4 per December 1st deadline. We did not disenroll them from SOAR 3 first. We just completed the discharges. Do we need to go back and disenroll? WITS, I don't know what the state requirement is on that, Ellen. I know that WITS won't care, I don't think, if they're enrolled in SOAR 3 and in SOAR 4. Yeah. So there you go. So yeah, so I mean, you could leave them in SOAR 3. Just be aware that like, like once that, I mean, you guys aren't using WITS for like entering in encounters and that sort of thing. So you shouldn't run into any other issues if for some reason you don't disenroll the client from the SOAR 3 program. Yeah.
I think where it gets confusing is if you don't disenroll them, you could potentially enter your new intake and follow-up in SOAR 3. Like you just have to make sure you're clicking on SOAR 4. So that would be a reason to disenroll, but yeah, I mean, technically, no, you don't.
Yeah. But yeah, so another question, can SOAR 3 completion and SOAR 4 enrollment be done on the same date of service? Yes, it should allow you to do that. Yeah. And then Chrissy's asking, so if I sign someone up for SOAR 3 today, I will wait until their 6-month follow-up, then complete that GPRA as well, then discharge them so that you can then enroll them in SOAR 4.
Okay, so we're not signing anyone up for SOAR
Yeah.
3 anymore. They are not getting signed up. So we're only signing up people in SOAR 4.
Yep.
So we finished signing up people in SOAR 3 at the end of September.
Correct. Good questions, all. And I forgot that I created a new section in the training that says reporting, which actually just covers the reports that we already went over. I forgot, I don't know why, that I put them in there. I couldn't find them originally, but yeah, so that's it. If you guys have any other questions, please feel free to ask. But otherwise, as far as the training goes, that's everything that we have for you today. The only thing I would ask though is this. As a trainer, I like learning just as much as I like teaching everybody. So if you guys would just take a moment to, I just dropped the link into the chat. Click the link to a survey and take a couple of minutes to complete it. Just let us know how we did, what we did well, what we can improve on, that sort of thing, if you would please. And then let's see what other questions we have coming in. Kelly's asking, do you need to be SOAR certified before doing this application process, or can you still sign them up without the certification?
Certified, SOAR certified. So I don't know what certified means in this situation. So a person needs, the agency determines eligibility for SOAR, SOR, SOAR. And so that's 300% of the poverty line and below, and they're underinsured or uninsured, and then you enroll them in at your LME MCO. Now, if there's somebody different that maybe does the enrollment with the LME MCO to get so that you can get paid, that's fine. And yes, you could go ahead and enter them into WITS and do the intake right then, the intake GIPRA. So I think that answers that question, but Kelly, feel free to follow up with Jaquetta and I afterwards.
And Sonia, you said that you're having a problem clicking the link. If that I've seen that happen a couple of times. If you just copy the URL, open up your web browser, and then paste it into your web browser, you should be able to access the survey that way.
Well, thank you, Scott, so much. And we really appreciate this and all the information. Love all the questions. Appreciate that people were engaged and learning. And we will be posting this online. And when we get that, we will post it in FEI WITS. To get you set up. So, and if you're get into FEI WITS and you're locked out, please contact your super user at your agency. Each agency has one, and they have the power to unlock. And we look forward to working with you throughout the year.
Sounds good. Awesome. Thank you. Real quick, Sarah's saying that she got a link, an email to click on to change her password, but she thinks it was actually to set up her sign up. And the link does the reset password link does expire after 24 hours. So in those cases, you'll want to reach out to whoever your administrator is, and they can resend that link to you.
Yes.
Yep.
Perfect.
All right.
All right. Thank you, everyone.
Thank you all. I appreciate you guys taking the time to learn with us today.